Coming up, we will be on location at Starbright Dental in Rockville, Maryland, discussing how you can get the beautiful and healthy smile that you've always desired through the latest advances in dentistry with one of this area's top dentists, Dr. Seifi. Dr. Seifi received her Doctor of Dental Surgery degree from the University of Maryland. She is a member of the American Academy of Cosmetic Dentistry, among others. Welcome, Dr. Seifi.
Oh, thank you.
It's our pleasure to have you. Your first time, I believe, on a new me.
Yes, it is.
Well, we've got a lot to talk about, and I understand there's going to be a patient joining us shortly. We're also going to see a procedure, not to mention patient before and after pictures. So let me just begin right off the bat, if I may, by asking you to please tell us about the significant advances which have taken place in dentistry over the last few years.
Yes, Rocco, there's been a lot. There's been a lot of actually advances, which let me start with one of the procedures that I actually do the most, which is called veneers. I do what's called the Lumineers, and right now they are one of the nicest, actually, the most advanced type of veneers that are around.
And this is a cosmetic procedure?
Yes, it is.
And what do veneers do, actually, doctor, for those of us who may not know?
Oh, that's a very good question. Basically, veneers are just a thin porcelain. It's like a shell that goes on top of a patient's tooth. So it can correct many abnormalities with the teeth. Like if a patient wants to immediately correct the way their teeth come together, or they want to close the spaces, or they've been unhappy with just the shape of their teeth or their life. Lumineers basically are just a 2 visits. There is no anesthesia involved.
So basically you're looking at, obviously, a treatment option here that you just mentioned that corrects crooked teeth, broken teeth, misaligned teeth. In other words, it can give us that look and feel that we used to have, or that we may have never had, to achieve that beautiful smile.
Exactly. And I mean, one of the most important part of it, because veneers have been around for many years, one of the biggest advances that this is a very thin, and in many cases we hardly have to touch a tooth to be able to put this on, because the technology has made it so thin that we don't have to really mess with the natural structure of the tooth.
So it's got a very natural look and feel to it, as opposed to a few years back.
Yes.
And that would be one of the major advances within that treatment option.
It is, absolutely.